Thank you so much, Mr. Chair and Madam Chair, and thank you, Ms. Blackwell, for letting me go first. I have an evening meeting to lead this in Clayton. I didn't travel as far as Ms. Woods, but I do have a trip ahead of me, so thank you very much. Do you mind if, can I stand? I had pictured myself giving a presentation on this PowerPoint, and so that's where my mind is right now. Thank you. I come from Union County, New Mexico, Clayton, Union County, New Mexico, in the northeast corner of the state. We are a rural community. In fact, we are called a frontier community. Our population is about 2,000. I am the director of the Union County Network, which is a 501c3 that convenes other organizations, individuals, local government, to develop community capacity, to look at some ways that we can solve our own issues, to plan strategically and collaboratively together, and then find ways to cooperate on some common goals. And that's actually what I have ahead of me this evening. Our programming includes physician recruitment and dental recruitment community marketing initiative. We have been working to recruit a dentist actively for 3 years now. We have been without a dentist for 12 years. And another program activity that we manage is the Des Moines School-Based Health and Wellness Center. And that is the only source of care within a 30-mile radius for that population, who often must travel an hour just to get to the road in the first place from the rural ranches. So again, we have a population around 2,000. When we're talking about the population that we might serve for dental care, we're looking at actually several different states intervening here of New Mexico, Oklahoma, Texas, and Colorado. So we are a center hub for that whole plains area of about 4,000 target population. Again, we're a very agriculture, ranching community, more cows than people. Local, and our main institutions are government institutions. Our schools are the center of our communities. We have a rural hospital correction facility. Some of the great things about our community, we say we're a small town with a big heart. We pride ourselves in being very independent. We like to solve things ourselves and to be self-reliant. That can help us in some ways, and it can hurt us in some ways as well. I'm sure you understand that. Again, we've been without a dentist for 12 years. Most people travel to Dalhart, Texas, which is about 57 miles. Other people travel, my dentist is in Amarillo, Texas, so I have a 2-hour drive. And other people need to go further if they're going, if they're Medicaid, or if they have an insurance that doesn't cross state borders. They're traveling to Springer, New Mexico, or to Raton, or even up to Trinidad, Colorado. What this means is a day off work or school. For me, it's a whole day off. And so our kids fall behind, our residents, our adults must take a day off work. It hurts our businesses. In fact, our EDC has been very involved in this effort to try to recruit some dental care into our community because our businesses are suffering from people having to travel out of town so frequently. And the truth is, not everybody travels out of town. According to a 2000 oral health survey conducted by the Department of Health, less than half of our population receives an annual dental checkup. And because of this, we are not seeking care when we need to. We are delaying care, and we are suffering because of it, and that's part of that independent spirit, just to suffer and live with it. But what happens is, in that same study of 2000, we were the number one county in New Mexico with the highest percentage of untreated caries and the highest percentage of untreated oral disease or needing care. We have taken several efforts to help meet our own, to provide solutions to our needs. As I said, our EDC, our hospital, and our network have been working actively to try to recruit a dentist. We have received a grant from the Health Resources and Services Administration to construct a new school-based health center facility that includes dental equipment and supplies for both prevention, diagnostics, and basic restoration. However, we haven't been unable to recruit a dentist to that new center. So we even have the capacity, we have the equipment, we have all of that overhead in place, but we can't recruit a dentist. We have worked on business plans. We have helped dentists try to access capital through some of the USDA programs. What happens is we don't have the population for the numbers to work. For the population overhead ratio just does not work for our community. We've been there, we've tried, we've accessed what resources are available. It is just not financially feasible to run a full-time clinic, and even a satellite clinic that we've been looking at is also a challenge because they get busy in other areas, and so we're left behind. And we're experiencing that right now. We have a dentist who has shown interest, finally, and he has a Tucumcari clinic, but he is deciding that he doesn't have a lot of time for Clayton and Des Moines. So we're hopeful, but we do not see a long-term solution in sight for our community, and we also are concerned for the other communities, the other rural communities who have a similar situation, or the underserved populations in the more urban areas who also have dentists that it's more economically advantageous to them to focus on efficiencies and higher end payments instead of the Medicaid population. So we have had inconsistent source of care for our communities, even though we've been working hard to develop something. We have run the numbers on dental therapists, and they work. That overhead population ratio works. The scope of treatment works. People would go to a dental therapist in our community because their records can stay in one place. They have someone they can trust. And it's a hub and spoke model where they can go to that dentist for follow-up care, for more advanced, more complex procedures, and they're constantly in communication with that dentist. Our school-based health center wants this. The Des Moines Schools Health Advisory Council wants this. Our schools, our community, we all see this as a good long-term solution for us. Our institutions and our community leaders have discussed this model. It is something that we support. And also, it is, I believe, a good economic move for New Mexico. It is also a good economic move for our community. It provides a new job opportunity for someone to go back to school for 3 years, and instead of going on to an urban area to pay back their tuition, they can come back and work right in Clayton and Union County. Plus, we have the support staff. We have the secondary spending in our community. There's a study that shows that approximately a new rural doctor can recapture approximately 60% of currently out-migrating services. So we've run that number and we see, okay, that can work for us too. That comes from the University of Oklahoma Rural Health Works. Plus, we're capturing a population that is currently not receiving services as well. We're not having dollars going out to Texas. And believe me, there are a lot of those dollars going out to Texas from Clayton. It keeps local dollars local. So again, we're committed to a long-term solution both for our community and for others around the state. We really see the potential in this. And we have the capacity as a community to support this in terms of nominating a DT to go to school. We have invested in some of the capacity for dental clinics, and we have the ability to continue doing so. We've started developing a health careers pipeline in our schools, so we are really geared up for this. It is a good fit for our community. Plus that DT would know, that dental therapist would know our community, also be invested in our community and to the health of our population. And so passing this legislation would give us that opportunity, would give our community that opportunity to really solve our own needs. And be a long-term, it would be a long-term solution, not just a short-term, and hopefully for other communities throughout New Mexico. So thank you, Mr. Chair, thank you, Madam Chairwoman, and thank you, members of the committee, for your time and consideration of this. Thank you.
Thank you, and really quickly,